Well, good morning, everyone. Bonjour, bon matin. My name is Robert Loiselle. I'm the MLA for St. Boniface, and I'll be your MC today. Avant de commencer, j'aimerais reconnaître que nous sommes trouvés sur les territoires visés par le traité numéro 1 et que le Manitoba se situe sur les terres ancestrales des peuples Anishinaabe, Anishinaabe, Dakota, Oyete, Denissulin et Nitiwak, et la patrie de la nation métisse de la Rivière-Rouge. Nous reconnaissons également que le nord du Manitoba comprend des terres qui étaient et sont toujours les terres ancestrales des Inuits. Nous respectons l'esprit et l'intention des traités et leurs conclusions, et nous restons déterminés à travailler en partenariat avec les Premières Nations, les Inuits et les Métis dans un esprit de vérité, de réconciliation et de collaboration. So thank you everyone for being here. Thank you to all the healthcare workers that are here with us, not only here in front, but working hard at work today at the hospital. Today is an exciting day for Manitoba. As you can imagine, as the MLA for St. Boniface, I was born here, along with my brothers Richard et Michel. En fait, mon père Lucien, ma mère Lucienne et mon frère Richard sont tous passés par les soins cardiaques ici à l'hôpital de Saint-Boniface. Ça fait longtemps que l'hôpital de Saint-Boniface prend soin de nous. D'ailleurs, l'hôpital célèbre ses racines de 175 années aujourd'hui. Et je suis fier de vous partager que mon frère Richard continue de recevoir des soins cardiaques ici à l'hôpital de Saint-Boniface. Now, to tell you more about why we're here today, I'd like to introduce someone that almost needs no introduction in Manitoba, or in fact in Canada for that matter, the Premier Manitoba, the very Honourable Wab Kinew.
We're here to announce $22 million to build HeartCare Manitoba, a new cardiac center of excellence right here at the St. Boniface Hospital.
Yeah.
Taking care of Manitobans when they need attention for heart conditions, for heart disease, is such an important priority. I think each and every one of us can talk about a loved one or a friend who's been affected by these conditions. And for women in Manitoba, as the awareness grows, this is going to be an important part of the healthcare services that we offer to people in our province. For many years, there's been wonderful, wonderful work done by the cardiologists and the medical team and the healthcare professionals here at St. Boniface Hospital. Tragically, when the PCs were in power, this program was cut, and it's now time for us to rebuild it. So I want to thank Dr. Soni and all the other experts here at St. Boniface. We have been working very closely with them to get to this point here today, where we can announce a real investment to expand the number of beds, the number of staff, and the type of services that will be caring for people when you need heart care here in Manitoba. I also want to take this opportunity to acknowledge the families who've been advocating and pushing for services like this. We're joined today by Morgan Ross. Many in the public will know her for the very brave advocacy that she's shown on behalf of her late mother, Stacy. So I want to say in front of the public, we're very sorry on behalf of the province of Manitoba for your mom's loss. And I just want you to know that when you and other Manitobans raise your voice, that is how we make positive change in our province. So thanks for your advocacy. So there's so many exciting different ways that today's announcement will help our province. More medical care, not just for patients here at St. Boniface, but really across our entire provincial healthcare system. More opportunities to recruit those bright shining lights that we want to see working in cardiac care and in our healthcare system. And perhaps most of all, just that reassurance for you that you're going to get the care you need when you need it. Miigwech merci. Thank you very much.
Next up, we have someone from the world of healthcare, someone that understands healthcare. And in fact, if there was an Olympic event when it comes to rebuilding the healthcare system in Manitoba, I think they would win a gold medal, the very Honourable Minister of Health, Uzoma Asagwara.
Thanks so much. Hello, everyone. Good morning. Thank you so much for joining us. I know this is an exciting moment. This is a big moment. But I can tell that this means a great deal to so many people because we've had several announcements here before, and I don't know that we've had this big a crowd of folks. And I know so many team members are here today to hear this news. And I just want to say thank you so much for working with our government from day one to do this really important work of rebuilding an essential part of our healthcare system that affects Manitobans in every corner of the province. I also want to take a moment to recognize that today is National Indigenous Nurses Day. There are so many Indigenous nurses who deliver the highest quality care across our province. They provide leadership, cultural knowledge. They share and give in a way in our healthcare system that is really transformational. And we want and need to see more Indigenous nurses practicing in healthcare all across the province. So if we can just take a moment and thank all of the Indigenous nurses on the front lines of our healthcare system. So today is about rebuilding cardiac care here at St. Boniface Hospital and here for all Manitobans. I want to acknowledge Dr. Soni, all of the experts, cardiac teams, physicians, nurses, professionals, admin, everyone who has worked together to not only get to this point, but for years to deliver the highest quality care under very difficult and challenging circumstances. We're talking about folks who are stepping up every day, delivering care to Manitobans, advocating for their patients, while these services under the previous government were actively being dismantled. And they have stepped up and have been working with our government to not only put this program back together, but to build a program, a center of excellence that is going to be one of the best again in Canada, but is also going to close some of those gaps in terms of how women access heart care in this province. And I think that that is fundamentally so important. For too long, we know that cardiac care here at St. Boniface has been stretched. We know that there is a lot of damage done, but through Budget 2026, as the Premier stated, we're investing $22.1 million to establish Heart Care Manitoba right here at St. Boniface Hospital.
Here, here.
So as part of that historic investment, this includes creating a brand new 5-bed cardiac assessment zone. So patients with heart concerns can be monitored and get the right care right away. It also means adding 14 inpatient beds so that more Manitobans can access cardiac care without delays. We're also strengthening how patients move through the system. I know that many of us have heard a lot about flow, right? About access block challenges. So we're going to do the work here to strengthen how patients move through the system with rapid cardiology consults in the emergency department, better coordinated through a centralized access office. These are real changes. These are real changes that are going to affect real Manitobans. They're going to help reduce wait times. It's going to help ease pressure on our emergency departments and fundamentally change and improve care for patients, Manitobans. St. Boniface Hospital used to be home to one of the strongest cardiac programs in all of Canada. It was an internationally renowned and celebrated program. This work that we're announcing today is about restoring that level of care. It's about supporting the people who deliver that expert care. And we know when our system is under great strain, it is not just patients who feel that burden. It is those folks who show up every day to deliver care to Manitobans. And so I want to take a moment to thank all of those providers, all of those experts, all of those folks who have shown up every single day, all of those folks who have continued to work with our government to take this really historic step in this moment. And I want to thank you in advance because we know there's a lot more work to do as we move forward, but we're very excited to do that work together to the benefit of all Manitobans. So thanks so much for being here today. Let's keep working together.
my name is Morgan Ross, and I am proud to stand here today as the daughter of Stacy Ross. My mother passed away on January 16, 2026 at St. Boniface Hospital. Her death should have never happened. Before my mother died, she was very sick. She went to the doctor twice and the hospital twice, but each time she was sent home and simply told to rest. On her final visit, she was brought to the hospital by ambulance, only to wait in the emergency room for 11 hours. My mother died because of the long wait time. Her death was preventable, and she should still be here today. Since then, steps have been taken to help prevent tragedies like this from happening to other families. Wab Kinew has helped bring attention to medinav.ca, a service that connects people with same-day doctor appointments so they may not need to go to the emergency room. He has also helped make it possible for St. Boniface Hospital to have a cardiologist on site for 4 hours each day. These changes matter. They can save lives and spare other families from the pain mine now carries every day. But more still needs to be done. My hope is that St. Boniface Hospital will one day have a cardiologist on site in the emergency room for 24 hours a day, so that no matter the time, help is available when it is needed most. Thank you.
Great job, Mary. Look like tremendous poise.
Thank you, Morgan. Thank you, Minister Asagwara. As I alluded to before in my remarks in French, my family has a special connection to St. Boniface Hospital. My father, my mother, and my brother all went through cardiac care here at St. Boniface and received excellent care. In fact, my brother Richard is still doing very well. I had coffee with him this morning. And to tell us more about cardiac care here at St. Boniface Hospital, I'd like to present Dr. Anita Soni.
Good morning and thank you. 25% of all deaths in Manitoba are due to cardiovascular disease. People living in the northern region have 2.5 times the rate of heart attacks and premature death. Over 5 years ago, Cardiac Sciences Manitoba was dismantled with fragmentation of the program, funding cuts of data, quality and support, and unclear provincial oversight. Despite this, our frontline teams have remained deeply committed to delivering high-quality, advanced heart care, built on a foundation of clinical excellence. I would like to sincerely thank our incredible team who work tirelessly every day to care for our patients. But inevitably, we have also fallen short. We have met with families whose loved ones we were not able to help in a way that they deserved. Those conversations are gut-wrenching, but they underscore why this work matters so deeply. Today's announcement marks a significant and decisive step forward in improving heart care for people across Manitoba. The $22.1 million investment focuses on initiatives that will have the most direct impact on patient care. This includes expanding inpatient cardiology capacity, increasing access to heart procedures such as angiograms, ablations, TAVI, enhancing more timely cardiology consultations in the emergency department, establishing a cardiac assessment unit, and strengthening coordination of cardiac surgery through a centralized access office. These are practical, high-impact steps that will improve access, reduce delays, and improve patient care. Importantly, this work is part of a broader vision to rebuild a coordinated provincial program through HeartCare Manitoba, with St. Boniface Hospital as the cardiac center of excellence. This approach brings heart care together across Manitoba, integrating cardiac diagnostic testing and using data to guide decisions, improve patient outcomes, and ensure all people receive timely, coordinated, and equitable heart care, no matter where they live in this province. I would also like to acknowledge the minister's leadership. Over the past few years, they have taken the time to listen to frontline providers, understand the challenges, and support not only rebuilding the program, but the opportunity to create a heart care model that strengthens governance and accountability. A sincere thank you to the Minister and your team. Make no mistake, there is much more work to be done, but this is a critical first step in rebuilding a solid foundation. For patients and families, this means getting the heart care you need when you need it, without delays, without confusion, and without falling through the cracks. This is about delivering heart care that is timely, coordinated, and centered on you. Thank you.
Next up, we have someone that understands that many hands make for light work. In fact, with her incredible team, she makes things happen here at St. Boniface Hospital. So I'd like to present Nicolas Mineau, President and CEO of St. Boniface Hospital.
Good morning, everyone. Bonjour tout le monde. My name is Nicolas Mineau, and I'm the President and CEO of St. Boniface Hospital. First off, I want to thank Morgan Ross for joining us this morning. My heart broke when I first met you, Morgan, and you told me the story of your mother. Morgan, we are striving to do better. This investment will go a long way. I want to welcome you all here to St. Boniface Hospital. I am so excited to have you here to mark this very important day for us. I also want to thank the government for this important investment. It was here at St. Boniface Hospital where Manitoba's first open heart surgery was performed in 1959. Dr. Morley Cohen successfully repaired a hole in the heart of a 5-year-old boy, kicking off a new era of cardiac care here in the province. We are proud of our long history here at St. Boniface Hospital and equally proud to be the home of the province's Cardiac Center of Excellence. It's important to acknowledge that St. Boniface Hospital is the home of everything cardiac, from extraordinary research done in our Institute of Cardiovascular Sciences in our research center, to women's heart care, to the clinical work done by amazing teams. We are thrilled that today's announcement reinforces the hospital's role as the cardiac center, not just for Winnipeg, but for all of Manitoba and the parts of Nunavut and northwestern Ontario we also serve. Being the cardiac center is very important to us at St. Boniface Hospital and to our board. It plays a central role in our strategic planning, and it's something we work hard to live up to. Ce rôle n'est pas juste un honneur, ni juste un titre, c'est une responsabilité, et nous prenons cette obligation au sérieux. C'est pourquoi nous sommes toujours en train de défendre les intérêts de nos patients et de notre personnel pour pouvoir offrir le meilleur service cardiaque possible. As I just mentioned en français, being the province's cardiac center is not just an honor or a title, but a responsibility, and one we take very seriously. It's why we are constantly advocating for our patients and our staff to be able to offer the best possible cardiac services to the people we serve. What a great day for Heart Care Manitoba and St. Boniface Hospital, but more importantly, for Manitobans. At the end of the day, it's the people who work in our heart care program who make all the difference. The staff and physicians who look after our cardiac patients are true healthcare heroes, literally saving people's lives every day and doing so with compassion and professionalism. It is honestly humbling and instructive to see what you do. I want to thank you all from the bottom of my heart for all you do for our patients. I hope this new funding will help support the great work you all do and will make it much easier for you to focus on providing world-class patient care that we are all grateful for. Merci and miigwech.
Merci, Nicole. Toujours un plaisir. So this concludes the formal portion of the announcement. We will now open the floor to questions. On va ouvrir le plancher à des questions.
Maybe for Dr. Tony, start please. You talked about some of the logistical aspects and benefits of this. For patients who are going to be seeking heart care in Manitoba once this center is complete, how does this impact your ability to serve them?
Now, once we have set up the Heart Care Manitoba, the vision is that St. Boniface Hospital is the hub, and we have clinical pathways to help patients all over the province and empower the hospitals and physicians in rural areas to look after these patients through our pathways and to know when they do need to physically come to St. Boniface Hospital. But as much as possible, we want to have their heart care closer to their home whenever it is possible. And if it's not, then those are the people we want to bring into the center.
Any other health questions? A question about how many beds you guys already have and how many beds. I'm wondering, are these beds new beds or newly funded government?
So about a year ago, there were some renovations. So some physical beds appeared on the new ward, but these were not funded for the doctors, nursing staff, pharmacy, all the allied health care. So yes, when the emergency room's in trouble, we fill every open bed we can find. That's all over the hospital, you know, sometimes in a hallway, hopefully not for very long, but without the supports to do that. So this definitely makes it a program where these beds are used, but they're properly used to the best of everyone's ability and with proper staffing and proper care for the patients instead of just stretching out.
How many staff, new staff does this require?
As the medical lead for the cardiologist for the ward, we were able to have our current staff cover the extra shift for the rapid cardiology consult and the cardiac assessment unit. As a group, we talked and said this is something we need to do. Our healthcare is in crisis. The emergency room needs our help. We want to divert patients from, we get 1,000 phone calls, consults a year, actually more, it's 4,000. And we bring many of those patients to St. Boniface Hospital. Can we bypass the emergency room? Bring them into the cardiac assessment unit. We already bring people in directly to the cath lab. So not everyone should come through this emergency room. So we knew we had to help out. And so we were able to honestly just do extra shifts. So all the cardiologists are going to be working a little harder. And if we need to, we will recruit new cardiologists.
In terms of the 4 hours of cardiologists, what hours are they? I think that's in the morning and elaborate why in the morning.
Yes. So we have cardiology consultation 24/7. Okay? We have at least 7 to 8 cardiologists that are on call every single day for different areas. There's always a cardiologist and a full team with residents and other healthcare workers, clinical and physician assistants that are on 24/7. What we realized was that between 8 and 12 o'clock, the cardiologist who's on call for all the consults, they're also looking after the patients on the ward and working very hard to discharge people in a safe and timely fashion. And so we realized during 8 to 12, as the volumes have all increased, that we were at a point where we needed to add an extra staff to help out. And that's why from 8 to 12, we've added that extra shift for cardiology consult. But absolutely, there's always cardiology consultation in the Emerge 24/7. This was to help any backlog from overnight and keep the flow going and get patients seen faster and admitted or discharged home faster.
And is the dedicated unit for cardiology right outside the ER, is that open yet?
So the cardiac assessment unit will be right beside the cardiology ward. After patients are seen by a cardiologist, they may need extra testing or extra monitoring or a consultation with an electrical physician. And then we may say, well, they can go home or they need to be admitted. So what we want to do is bring these patients up to the cardiac assessment unit to free up the emergency room for other patients. They'll be in this unit. It'll be a rapid turnover unit. Hopefully we can send most of these folks home. If not, we admit them to the cardiology inpatient beds.
When will that open?
July 1. The Rapid Cardiology Consult team, just to show the dedication of our team, I'm very proud of this. The second the budget was announced, we had cardiologists who already had their schedules all completely made sign up to volunteer for these shifts. Up until July 1st, when our new schedule starts, 80% filled. And that was during spring break when a lot of people didn't have access to their emails. So thank you to all the cardiologists who filled in. Thank you.
Sorry, the funding, so is that all for this year, or how many years is that?
My understanding is this would have to be an annual commitment. This is for patient care, and operationally, all these things have to happen all the time.
Une question en français, Madame la Alors, on a fait un peu sur l'effet que ces annonces pourraient avoir sur le rural. On a parlé de l'hôpital comme un hub qui pourrait soutenir les entreprises. Est-ce qu'on peut parler de ça plus en détail?
Ben, c'est pas moi qui est l'experte en ça, mais je pense que Dr. Soni elle a expliqué assez bien que si le monde ils ont besoin de venir à l'hôpital Saint-Boniface, on a maintenant les mécanismes pour faire ça. Si on peut les traiter où ils sont, plus proches de la maison, ils peuvent avoir leurs tests là, et puis les cardiologues, ils peuvent lire les résultats ici.
Aussi, comme le député Loiselle l'a mentionné, je pense que vous avez dit qu'on est à 175 ans pour l'hôpital. Selon les surprises, je pense que c'est 165, c'est bel et bien l'anniversaire aujourd'hui.
Je ne sais pas si c'est l'anniversaire aujourd'hui.
Cette année.
Oh, c'est l'anniversaire cette année.
Cette année.
Puis cette année, oui. Mm-hmm. OK.
I wanted to bring up, if someone needs a procedure or treatment that they can't get here, where do they normally go? And do you foresee this reducing the number of locales and elsewhere?
I think I can handle that one. We do so many innovative procedures here in Winnipeg. The procedures that we can't do here, I would say the big one would be heart transplantation, for instance, and some very specialized congenital heart surgeries. We have a very keen and talented group of cardiac surgeons that are wanting to bring different surgeries to Winnipeg, so we're working with them to start developing those programs for Manitoba. And we have an interventional cardiology group that is cutting edge and doing amazing procedures here. When there are certain cases that really need a center such as Edmonton or Toronto where they may do a very specialized procedure, then we do send patients to these other centers. But again, this would be for procedures where we feel they're too complex for what we can do. And we're really trying to develop these procedures and surgeries here in Manitoba. We have just the highest quality of physicians here that do the procedures and the surgeries, and I'm really proud of that. That's something we've always had, and we've been able to maintain it.
Okay, I have another health question for Minister.
The topics will ask our validators to just clear.
Oh, no. Actually, no, we're going to hold. Yeah. Thanks, Susie.
The mother originally from the Ivory Coast, you have spoken to them. They speak French, very little English. She was left bleeding heavily in the waiting room after being given abortion pills following miscarriage. He says there were no French equivalents there, and he had trouble understanding the medical information. He wasn't able to speak English. What's happening now? The hospital reviewing.
Yeah, so I have spoken directly with this Manitoban, connected her to patient relations, making sure that there was somebody obviously French-speaking who could engage with her and make sure that she could have all of her questions answered. So the hospital is actively providing support to her, reviewing her case, and will ensure, of course, there's the appropriate translation services supporting her every step of the way. I'm just going to say the hospital is doing their due diligence. They're reviewing this case and supporting her in the ways that she's identified she needs support. That's a huge priority for our government, and it's not just at St. Boniface, it's province-wide. So we work with partners like Santé en Français. We work with partners across the province to ensure that we're really making key investments in ensuring that people can have access to French services, not just translation, but getting more French-speaking providers, Francophone providers on the front lines of our healthcare system. We're actively working with St. Boniface University to ensure that we're getting more folks trained up in key aspects of healthcare, and then making sure they're connected with jobs in our healthcare system. So this is a provincial effort that we're making, recognizing that we have Francophone Manitobans in every corner of this province, and no matter where you live, you should be able to get access to care in your language that is most comfortable for you.
The same patient, it looks like they've said to us that your office assured her that she gets support and that a review will be conducted. But she hasn't heard anything further. It sounds like she was told a certain day that they can pass.
Yeah, I can't speak to any conversations that she's had with the hospital themselves or the patient relations folks that are providing her support. My office has been in contact with her. Like I said, I've spoken with her directly. I've given clear direction that the support that she needs or that she requests should be provided. Of course, making sure that these services are provided to her in French so that she is most comfortable, can communicate most clearly, and have all of her questions answered in full. So if there are ongoing concerns, of course, my office is going to make sure that she gets full clarity, the supports that she needs are in place, and we're going to work with the hospital to make sure that every step of the way she's given information as it's available. Yeah. You know what, we've had a lot of conversations with Dr. Soni and her team, leadership here. I've met and had conversations with some of the experts who first established the Cardiac Center of Excellence. So I think of a Dr. Minkus as just as one example. And I can certainly appreciate, I think our whole government appreciates concerns when you look at what happened under the previous PC government, where we had this best-in-class cardiac center of excellence here in Manitoba, and nobody could understand why then it was being dismantled. Why was it being cut? Why was it being pulled apart? This was affecting real Manitobans. So I appreciate the concern that people have regarding what are we going to do as a government to protect this new program that we're reestablishing. And so we have been exploring ways beyond what will be a very strong governance structure. Dr. Soni and her team have brought forward a proposal for that we're looking forward to supporting. Again, we've talked with experts who helped establish this the first go around, and we understand what we can learn from them in their journey. But we are also exploring any legislative opportunities in front of us in terms of protecting this, what will be reestablished as one of the best programs in the country. And so our government is committed to not only making this historic investment, but protecting it for generations of Manitobans to come. And so we're looking at ways that we can do that by way of law, by way of governance, but certainly we'll be working with our partners every step of the way to do this the right way, to make sure it's intact for Manitobans for a very, very long time.
If there are legislative changes, when is that going to be?
We currently have our legal counsel exploring options in this space. They'll be presenting them to myself. I'll be sharing them with Dr. Soni and her team and the Premier, and we'll go from there. But the first step is this big announcement today. It's showing Manitobans that when we work together, when we listen to experts, when we listen to families, when we work together, we can take really big steps in the right direction. And, reestablishing Heart Care Manitoba as the cardiac center of excellence here at St. Boniface Hospital is important. But as Dr. Soni very aptly said, there's more work for us to do. That includes taking steps to protect this infrastructure and just making sure that we focus on continuing to strengthen these services. There's no finish line here for our government. Our goal is in making sure that we continue to take steps in the right direction, continue to strengthen cardiac care for Manitobans, and work with the experts who understand this space best.
Why is there a delay in staff training?
Well, as you can imagine, and first what I would say is thank you so much to all of the folks who have been working very, very hard to make sure that Portage Hospital can open with success. This is a big, big project. It's a much larger footprint than the original hospital itself. We are also actively, as a government, modernizing healthcare in Manitoba. So folks will know, probably many folks who are here, maybe you've got the plastic health card in your wallet. Maybe you've got the digital health card now on your phone. Maybe you still have that paper health card. I don't know why you would, but maybe you still have that paper health card because you're attached to it. I don't know. But we're taking real steps to modernize healthcare in Manitoba. And that means that new health infrastructure that comes online is going to have fully modernized digital infrastructure. So it's a complex project, and we want to make sure that we support the region, that we support all of those leaders, all of those frontline providers with the right tools that they need so they can welcome the first patient in the best way possible, to make sure that you've got the right number of frontline staff to deliver care. And, I have to say that when I came into this role as a minister, I was shocked to learn that the previous government had done no human resource planning for that hospital. They were so focused on cutting health care and firing nurses that they didn't do the basic work around making sure that they had a plan in place with the region to fully staff this hospital. So we've been working very closely with the region to make sure that we are retaining staff, that we're training more, we're recruiting more healthcare workers. We just had a super successful job fair, recruitment fair a few days ago here in Winnipeg, where we were able to get signed job offers in the hands of dozens of healthcare workers in this province, including in rural communities. So we're doing what's necessary to make sure that we can staff Portage Hospital, and the leaders there have asked for a bit more time. We're gonna give them a bit more time, support them. If we can get the hospital opened earlier, of course we'll do that. But we want to make sure when that first patient is welcomed to the new hospital, the best quality care is there for them, the human resources are in place, and all the right steps have been taken to make sure it's a full success. You know what, we can get you that number offline. What I can tell you is that we want to make sure, again, it's a much larger footprint. This is a much larger hospital than it was previously. We want to make sure that we've got as many staff as required. We want to make sure that when these units, when these areas of the health hospital open, that they're open and they're fully staffed, that patients can trust when they show up there to get care, all the resources are in place. So they need a bit more time. We're going to support them with that, and really looking forward to being there, welcoming that first patient on day one. Okay.
Regarding the patient who suffered miscarriage, can you confirm that the contact that your office has had with her has been to deliver the services you talked about? Or
I missed the first part of your question. I apologize.
regarding the patient who suffered the miscarriage in the hallway, can you confirm that the contact your office has had with that person has been to deliver the services you talked about, or is that to say that they would be coming? Because that's from what we
I don't understand your question.
So I said that the person said that told us that your office has been in contact, that there would be a review, and that there would be services coming, but that there hasn't been that contact.
Okay, so that is, I can't speak to the dynamic between this person and the hospital, right? So our office has been in contact with her. I've been in contact with her. We've given clear direction for the hospital to be in contact with her as well, and to make sure that every step of the way she's fully informed and has those supports. So if that has not happened for some reason, or there's some confusion there, of course, we're going to look into it and make sure it's immediately addressed. Yeah.
Any other questions? Boniface? Okay.